brings us to this. The CDC does want to know more about MISC, or multisystem inflammatory syndrome in kids. It's linked to COVID-19 and one of 4 hospitals included in the research, Phoenix Children's. So this morning I go in depth with the experts taking part in this ABC 15 Health Insider report. Dr. Wasim Balan is no stranger to multisystem inflammatory syndrome in children, also known as MISC. The ABC 15 Health Insider is an infectious disease doctor at Phoenix Children's. He's now on a team of medical experts selected by the CDC to investigate this rare but serious condition that affects children weeks after a COVID-19 infection or exposure.
So with Phoenix Children's, we're actually one of 4 hospital systems that are doing a study with the CDC to learn more about this reaction. Keep in mind, this is a reaction that we started seeing, in April and May of last year, initially in the UK and then in the US. So this is a relatively new disease.
The CDC says learning more about who is likely to be diagnosed with MISC and how often it happens is key to help provide guidance for all healthcare providers and parents.
We've built up more information and more, knowledge about how to manage this reaction, but we need to continue to do more studies on that reaction to see what is the best way to recognize this disease and how to manage it.
The Arizona Department of Health Services tells ABC 15, since the beginning of the pandemic, 116 MISC cases have been confirmed here in Arizona. 3 people have died.
And what we know so far, and this is something that all the studies so far are showing us, and including our experience here at Phoenix Children's, is that those patients usually are coming in with fever. More than 90% of them have abdominal pain, vomiting, diarrhea, so any kind of GI illness. So that specific system seems to be the most commonly involved in this reaction after the infection.
A rash, difficulty breathing, headache, lip and tongue swelling, along with eye irritation, all warning signs for parents to watch for, up to 5 weeks after a child is either exposed to COVID-19 or is recovering from the virus.
If you think that your child is sick, bring them to the emergency room. Obviously at Phoenix Children's, we've seen a lot of patients with this reaction, and the physicians are familiar with how to recognize this reaction now and how to manage it in the hospital.
Also want to let you know that according to the CDC, there are 36 deaths tied to MISC here in this country, and the long-term effects, well, they are still unclear, which is part of why this study is happening. Do you have a question for our ABC 15 Health Insider team? We hope that you will send your story ideas and your questions to Health Insider at abc15.com, and you can see all of our stories there at abc15.com/health.